Hi, everyone, and welcome to Club Grubbery. It's time for another great interview. It's great to see you back on the screen, Johnny.
Thanks, mate. Great to be back. And yeah, the guests are wonderful. They just keep coming and coming. International flavour, Hoodie.
International flavour, and we've just had another one to add to the list, Andrew Bridgen from the UK. We've got some really great guests lined up, and none more special than the one we have on screen with us now from Florida, Dr. Kimberly Biss. Great to see you back on, Kim.
Yeah, thanks for having me. It's a pleasure.
Kim, we spoke to you as part of a panel for the Lighthouse Declaration. You were out here a few weeks ago in Byron Bay, and it was a great discussion. And that interview really churned up our viewing audience, and there's been a lot of interest in it. So we've decided to get you ladies back on one at a time. We had Ross Jones on just a few days ago, and she's an amazing lady. And likewise, you bring a whole new perspective to everything around COVID vaccines and everything else that's gone on in the COVID pandemic. But the one thing I like about you, watching some of the stuff that you've done, you're not sort of, it's pretty clear that you're looking at this from a very clinical perspective without being overly emotional about it. So we can
Mhm.
sort of listen to the data and look at the data that you represent and think to ourselves, well, this lady is the real deal. She's not out trying to cause trouble. She's just stating the facts. So we really
Mhm.
appreciate that about you, Kim. And I know you have some slides to present, but let's do a brief overview of the journey you've had with COVID. Um, you are an obstetric gynecologist. You've held many administration and leadership roles. You've received many awards. You're highly rated in America by some circles, maybe not so many now since you've spoken out. You've just been appointed to the Advisory Council on Immunisation Practices, and you make recommendations to the CDC. How do you think that is going to work in the climate that exists at the moment under Robert F. Kennedy Jr. and the CDC's involvement?
Well, it's very politically charged, of course. Everything that Bobby says is, hogwash and conspiracy theory, etc. I'm just hoping that we can get a lot accomplished because, our midterms are coming up this year, and if we lose control of the House and Senate, I'm sure they're going to quickly impeach Bobby, and then all of our efforts, will fall by the wayside. So I'm hoping we can get a lot accomplished before that happens. Hopefully, it won't.
Have there been changes within the structure of the CDC to enable you to work better with them, or is it still the old guard?
There's been a lot of changes. I'm newly appointed, slowly figuring out how inefficient our government can be. I haven't been to an official meeting yet. The first one I'm going to attend is the end of this month. So it's a lot of learning for me as well as far as how the process goes, etc. But the good thing is I'm one of three obstetricians that are on the panel now. Traditionally, they didn't have OBGYNs on the panel. ACOG, American College of Obstetricians and Gynecologists, they kind of make suggestions to the committee, but that's as close the committee's had as having, representation of OBGYN. So I think it's very important because coming down the pike, it could be that pregnant women, at least in the United States, would receive 7 vaccines during pregnancy. And when I started training, we only provided flu vaccines. So this is crazy.
It is absolutely crazy. And I want maybe if you could give us a brief summary, a before and after summary. I want to go back to 2020 when the pandemic was, rearing its ugly head, and
Hmm.
you were obviously treating pregnant women all over the place. And can you tell us what it was like pre-vaccine rollout? How were you treating women? Were there any side effects from COVID? You obviously treated many women who had COVID. What did you
Hmm.
notice? And then take us into when the vaccines rolled out, the differences between those two periods.
Yeah, so I was the chief of staff right before the pandemic was declared, was when I started that role in my hospital, which is a 450 bed facility. We're a trauma center, we're a high risk obstetric referral center. We represent all medical specialties at my hospital. I'm in St. Petersburg, which is a small city. There's other hospitals. My county is a little over 1 million in population. So in the beginning of the pandemic, we were having twice, sometimes thrice weekly meetings with other people in other hospitals, etc. And the point in me telling you this is that if there had been a high rate of maternal issues or maternal mortality, I would have been aware of that. And that was not the case in 2020. I know of two pregnant women who died, uh, one of which was after the vaccines were rolled out, but during, once the pandemic was, declared, my hospital did not have any maternal mortality from COVID. We did have sick patients. A lot of them were hospitalized because doctors get very scared when a pregnant woman's sick. So, probably a lot of those hospitalizations didn't need to happen. Most were, admitted for observation and sent home in a day or two. And they, in my experience, pregnant women did well with COVID. I saw a lot of big bad things start to occur after the rollout of the vaccines. And that is backed up with data. I tracked a lot of things, but mainly what I tracked was the miscarriage rates. But there was a new article that came out. It's in my slide deck, but it confirmed what I was seeing after the vaccines were rolled out, that the hypertension disorders like preeclampsia in pregnancy skyrocket after these vaccines rolled out. And I wasn't the only one noticing that. My labor and delivery nurses were making comments to that effect, as well as my anesthesia colleagues. So, I think we've always been taught that pregnant women are fragile. They're going to become more sick if they contract a respiratory infection. And I would argue against that because in 30 years of taking care of almost 8,000 pregnant women, I never had a pregnant woman die of the flu. You know, I have hardly ever had a pregnant woman admitted for the flu. Uh, you know, so I think actually pregnant women are a little bit more robust and strong. Otherwise, we would all be taking care of very sickly patients, and that's not the case. So.
Wow. And you would have, were you prescribing pre-pandemic, were you prescribing hydroxychloroquine and ivermectin for treatments at all with pregnant women for other issues?
So I wasn't allowed to do so. My practice is part of a large organization. We have a chief medical officer and we have protocols. And I was allowed to prescribe Dr. Zelenko's protocol, may he rest in peace, Seb Zelenko, minus the hydroxychloroquine. I prescribed the quercetin and all the nutraceuticals to our pregnant patients. And fortunately, in Florida, they had access to the monoclonal antibodies. So I put everybody on that protocol, but I wasn't allowed to prescribe hydroxychloroquine or ivermectin,
But you probably would have
sadly.
been pre-COVID, wouldn't you? They were drugs you would
Oh,
normally
sure.
use for certain treatments.
I mean, lupus, for example, lupus patients take the same dose of hydroxychloroquine every single day of their life that we would have prescribed for 5 days for COVID infection. And yet, that's dangerous in pregnancy if it's prescribed for COVID, but a lupus patient can be pregnant for 9 months and take the same dose every day, and that's not dangerous. Can you
Johnny
sense?
Latta,
I'm very sarcastic, so I apologize for that.
you're in sarcasm central on this program, I can tell you, Johnny.
Right. Kim, before we get into your data, can you maybe give some narrative around this change in in mindset, or I don't even know if it's a change in mindset, but I think you just touched on it there before that, to the best of your knowledge, you've never really had anyone significantly ill that's pregnant from having the flu, but there's been this creep of you can't have alcohol, you can't eat
Hmm.
this sort of cheese, you can't have fermented this. And that's been widely accepted as being, a good thing because, we don't want developing fetuses to have any problems. But these vaccines, I mean, here we go. There's 7 of them you suggested,
Hmm.
and they're just under the camouflage of night brought in, and nobody blinks an eyelid. They're just deemed to be not a problem. What do you say about that?
I mean, I thought about that very subject earlier today. I can't, I started training in 1993, and I can't say exactly in time when there was this shift from, you know, don't give a pregnant woman anything unless it's absolutely necessary and you can justify why you're giving the pregnant woman that medication, to now it's carte blanche. I mean, don't eat tuna fish out of one corner of my mouth, but get this experimental jab safe and effective. Um, and sadly, we've been conditioned. I think this kind of started when I started medical school to just trust our higher authorities. So our governing body would be ACOG, but ACOG is a panel of doctors just like me. I mean, they're not superior to us, but a lot of what they say is taken as gospel. And a lot of doctors today they just don't think outside of the box. We're all just sadly following algorithms and protocols. And if you dare to step outside of that, then you have to answer to some hospital committee or a medical board. So we're not really practicing medicine. We're just robotically
Mm,
doing all the same thing. And, we do fashion a lot of our safety in medicine after the airline industry, but people don't come off assembly lines. I mean, we're all different. There's different ways to skin a cat, but we apply the same, protocols and treatments to everybody across the board. And that was a huge mistake with these COVID vaccines, if you want to call them that, because really we shouldn't have treated every single person walking the planet, because not one of my slides will reflect, the most risk to this virus were the elderly, which is the same with any respiratory thing.
mm, mm. And I think the big problem is, Kim, the the mouthpieces for all this stuff, the people who ultimately get in the ear of, the average person sitting in front of their television set, or walking into the local chemist. Uh, they're paid. They're usually paid apparatchiks of the pharmaceutical companies, and these bodies, these professional bodies, like the in Australia, the professional um, overarching of obstetrics or of general surgery or of general practitioners. I mean, they're all people who were captured.
Hmm. Yeah, exactly. I mean, big pharma runs the world, and especially, in New Zealand and the United States, those are the two countries where direct advertising is allowed to consumer.
Mm,
And, I know that Secretary Kennedy, one of his goals is to stop advertising from pharmaceuticals, because if we can do that, they're not going to own our media anymore, which is, everything's brought to you by Pfizer. And so aren't a lot of the contracts paid for by Pfizer of the media personalities. So there's no way they're going to, spew the truth. So,
Yeah, wow. Kim, you mentioned the medical profession gleaning a lot of practical use information from the airline industry. I was involved in that during my aviation career as a sideline. We were teaching people in the military how to communicate and solve problems, and the same thing with the medical profession. One of the basic tenets was a model called SADIE, SADIE, which stands for share information, analyze the information, then develop a solution. Then, when everyone is in agreement, implement the solution. And then the E at the end is evaluate. How's the solution working? If it isn't working, go back to the S and start again. It would appear to me that not much of that was actually followed in the process of developing vaccines and implementing the rollout.
Correct. Correct. But hopefully Rand Paul, one of our senators, just highlighted a bill he's pushing forth to eliminate the protection from liability bill that was created many years ago to these vaccine companies, because if they're not going to get sued for their poisons, then they're not going to test them. What's the point? That's wasted money on their end. So if we can get rid of that, those liability shields, with traditional vaccines, of course, the COVID vaccines are protected by the PrEP Act, and that's a whole other animal. But, all the childhood scheduled vaccines and the adult vaccines prior to COVID are protected from liability, and that needs to go away because everything else we take or we use, any other product we use, our cars we drive, etc., I mean, they're not protected. So if they're so safe and effective, why do they have to be immune to liability,
Well, like safe and defective.
Yeah.
Another question, John, before we maybe go to the slides.
Why are those, Kim, why are those vaccines? I think that eventuated from Ronald Reagan in the 80s. So why does that flow on to other countries?
I don't know. You'd have to ask those governments, I guess. I mean, I don't know. But
Yeah,
it's
it would seem odd that, something that's enacted in the United States would have carriage in Australia, for instance. You would think that those products would have to undergo some sort of liability exclusion here. Maybe that's a loophole.
yeah, I mean, I guess that's something that, I mean, I don't know how your government works, but
We
maybe
don't know
from
either.
some grassroots. I really probably don't know how mine works, but some grassroots. I think the people, but it's sadly, I think a lot of people aren't aware of that, right? And but I think that everybody needs to fight for that. If that's the policy in your country as well, then the people need to get rid of those policies. I mean, hopefully we can here because obviously things tend to roll downhill. Like you said, a lot of what we do here is modeled after. So, fingers crossed that becomes a reality.
I think it's pretty clear that there is a global agenda in this because every newsreader on every news station in every country around the world, they seem to parrot the exact same phrases all the time. Like when the World Economic Forum brought out "Build Back Better," every politician and every media outlet was saying "Build Back Better," safe and effective. How many times? And what about that really great one? This is a pandemic of the unvaccinated.
Hmm.
I mean, we just see this parroted out. So clearly, everything you just talked about, John, to me indicates that there is an overarching global authority that just seems to run all this, and we could sure do a lot better for the planet if we got rid of the UN and the WHO and the WEF. But Kim, you've got some slides to show, and I think they're important slides. So let's run
Okay.
through those and use the time we've got available to really ram this home. And before you do, why are we still going on about COVID? Do we need to be talking about this still?
Absolutely, because this was just practice run for the next thing they're going to drop on us, right?
Right. Yeah.
And sadly, there's a lot of people that have been damaged and injured from these injections.
Yeah.
And, this was again just a practice run because they want to apply this technology now to many other vaccines and other products, down the road. And we need to, not allow that to happen. They're dangerous and they cause harm to people.
Yeah. Okay, the screen's all yours, Kim.
Continue to share. Okay, can you see? Oops. All right, can you see that?
Yes, we can.
Okay. Okay, so this is me. I have been practicing OBGYN officially since 1998, but started my training in 1993. Prior to the pandemic and the vaccines, I was just, a general OBGYN. This never would have been my thing. I never gave talks to people. I never was I didn't even know what a podcast was, in all honesty. But I met Dr. Thorpe in the fall of 2022, and within a week he had me on my first podcast, which was an utter disaster. But anyway, you haven't been able to shut me up ever since. And like you stated, I've most recently been appointed to the ACIP committee, so hopefully we can affect some change with regards to, making sure what we're doing is actually safe and needed. We're the most vaccinated people on the planet in the United States, and we don't have the healthiest people. So, and I always have to say, I'm speaking to you on my own behalf. I don't represent my employer or the hospital.
Yeah.
So, as you know, I was recently visiting your island and I got to get up and close with Benedict at the Lone Pine Sanctuary. So, that was actually the highlight of my trip. Such a cutie. I also I was on a cruise a few years ago and I got to hold a sloth in Honduras. And, neither one of these animals make any sense from an evolutionary standpoint, but they sure are cute.
Amen to that.
So I just wanted to kind of remind everybody, initially, the numbers in the middle of that slide are what were predicted was going to be the infection fatality rate, which means people dying from the COVID infection or SARS-CoV-2. And Neil Ferguson was the UK scientist who came up with these figures, which were refuted by John Ioannidis. Sadly, it took a while for him to come out with this data, but you can clearly see how off Ferguson's numbers were. I mean, for example, a child from the age of birth to almost 20 has a 3 in a million chance of succumbing to SARS-CoV-2. I will tell you, in the United States, we had 330 children die in 2020 that were infected with the virus, but they all had a significant comorbidity. Most had stage 4 malignancies. These were not healthy children. We did not have a healthy child in the United States of America in 2020 that died simply because they had a COVID infection. Why are we vaccinating 6-month-old babies? That just makes no sense. My age population would be 20 to, the mid 40s. So even those numbers are very low with regards to death with COVID. So I just wanted to bring this to everybody's attention because we really have to think, why are we doing what we're doing? I mean, the majority of the deaths occurred in the very elderly population, which would be true with any respiratory virus. And may I remind everybody, in 2020, miraculously, we didn't have influenza. We only had COVID. But every influenza season, we do sadly have elderly people succumb to that. This is an article that Beth Pinellas published in 2022, I believe. She had compiled data from a huge population of women that either were pregnant or not pregnant and admitted to the hospital with COVID-19. And she proved with statistical significance that if you were not pregnant, you were more likely to die from COVID than if you were. And my theory on that, and this has not been proven, but the ACE2 receptor is what this spike protein likes to attach to and cause issues in the body. And I would venture to say that maybe in pregnancy, that whole process might be downregulated. I don't know how you would prove that, but that's kind of my working theory right now. But anyway, this was not published, sadly, until a year after, the vaccines were rolled out. But this population in her study, none of these people were vaccinated because this was primarily in 2020 and the early part of 2021. This is this has been changed, but initially FDA, this was their categorization of drugs and, what every practitioner referenced before they would prescribe a medication to a pregnant patient. Most of the drugs that we prescribe to pregnant women fall under category C because ethically, we can't really test a lot of things on pregnant women to see what happens to them or the fetus. So most of that data is relied on animal data. Um, I would say, as would James Thorpe and many others, that these COVID injections should be classified as category X. We clearly have data showing that these are not safe in unpregnant, population. But coming down the pike, which I'm going to show you moving forward, we can clearly, I would say that these are not safe to be given to pregnant women.
Wow.
I was kind of surprised, honestly, as an obstetrician, that we would even think to give these to pregnant women. I was thinking I wasn't even going to have to ever talk about these to my patients. We should have obstetricians remember two drugs, in the past, diethylstilbestrol or DES and thalidomide, before we ever would have entertained prescribing a brand new novel out the gate treatment. DES was a hormone blocker that was prescribed to prevent miscarriage and preterm labor, and it was prescribed to many millions of women and stopped being prescribed when we realized it really didn't work. But sadly, we started to link the offspring to these women who had received that medication were starting to show higher rates of malignancies, specifically cervical cancers in women, but there's also some issues in men with genitalia development and possible development of, genital cancers. But cervical cancer is what's known to be the most common thing linked to this exposure. And we're now seeing that the offspring of the offspring may also be affected. We call these women DES daughters, and they need to have pap smears for life because they are at high risk for cervical cancer. Thalidomide, which you all would know would be the flipper babies. This was a drug that was primarily prescribed in Europe. Thank God we had somebody with some integrity in the FDA at the time because that Dr. Kelsey didn't want that drug, in the United States or prescribed to our women. But this was prescribed to prevent morning sickness. But if the fetus didn't die in utero, and was born, had multiple anomalies, may have died shortly after birth, but the most common is the fecomelia, which is the flipper. The limbs didn't develop, but there were other abnormalities as well. And this was also given to many tens of thousands of pregnant women. And it's still a drug used today, not in pregnancy. It's used to treat leprosy. Funny story too, it was also rebranded to treat multiple myeloma. A 1 cent that it costs to make a pill, quickly turned into tens of thousands of dollars to buy the same drug branded under a different name for multiple myeloma, and it doesn't work, but it does make some oncologists very wealthy, sadly. I just wanted to kind of go down the timeline. These are very busy slides, but I have the numbers highlighted as far as how this was, allowed to be prescribed in pregnancy or recommended in pregnancy. So the original trial that granted these drugs emergency use authorization was done by Pfizer on their product. And if you look at the numbers, Tony Fauci got up on stage and said, oh, goody, we have a vaccine. It's 95% effective. But he wasn't quoting the correct statistic. He was quoting the relative risk reduction, which is just a difference in the numbers between the placebo and the treated arm. But what a patient wants to know is the absolute risk reduction, which is, doctor, if I take this medication or injection, how much is that going to prevent me from getting the infection? And that was actually, for severe COVID, that was actually 0.037%, guys. That wasn't even 1%. All these people took these injections for not even a percent possible benefit, okay? But what's important was no pregnant patient was entered into this trial, nor were you allowed to get pregnant if you were in the trial. If you were a male in the trial, you were told not to have sex with your partner or anybody, and if you did, wear 2 condoms. So obviously Pfizer knew that something could possibly be transmitted in semen. There were some pregnancies that did occur in that trial. That's what the arrow shows, and there were a lot of miscarriages. Now, what we were taught for many, many moons, which has since been refuted by Naird et al. In 2022, was that a normal miscarriage rate is 15%, and I've never seen that clinically. Naird actually showed that the normal miscarriage rate the first trimester is about 5 to 6%. So this was a danger signal right away, because the pregnant patients that occurred in this trial, the miscarriage rate was higher than normal. Now, what then ended up happening was, once this was a granted emergency use, we had several phases of the rollout. And the first phase was in the first responders. And I don't think it's because they really gave a crap about the first responders, but I learned in raising money for foundations, if you get a doctor to give your hospital money, the lay public will soon follow, because if the doctor's doing it, it must be a good thing. So, the first responders all got these injections because they wanted everybody on the planet to follow suit. Now, some of those women were pregnant, or shortly did get pregnant after they received the injections, and that's what the post-marketing data showed, as well as what Naomi Wolf has highlighted in the Pfizer papers, which would have been the V-Safe data. Women that received these injections, they had to log into with an app on their phone any problems they had with the injection. Now, I'm guilty, as are other people, with regards to what Naomi Wolf has presented, as well as the V-Safe data, and coming up with anywhere between 80 to 82% miscarriage rate, which clearly on its face, if that were the case, we would be severely underpopulated right now. But so the arrows are how I've updated these slides to where, yes, the post-marketing data that we were allowed to see, if you do the math with the numbers we were provided, that does give you an 81% miscarriage rate, but clearly there were many more people than 270 that were pregnant and received this injection. Now, also, the Tom Shimabukuro article, which highlighted the V-Safe information, that was argued that there was an 82% miscarriage rate in the math in that paper. But when you actually ask for the data and you receive the correct numbers, the miscarriage rate was elevated at 9.2%, which, again, I've stated the normal rate's about 5 to 6%. So we had very early on, up to June, danger signals with regards to giving this in pregnant women. And we also had a lot of women complaining of changes in their menstrual cycles, and they were poo-pooed with that, but that's how we work, guys. I mean, if our menstrual cycle's off, is there any surprise that there's infertility or problems with pregnancy? Okay. So, but in any event, Rochelle Walensky at the time was the head of our CDC, and she stated in April 2021, these are safe and effective in pregnancy. Based on what? There were no trials, and we had some danger signals, but she stated that. So that is that, along with the Shimabukuro article that was published in June of 2021, is what later led in July of that year to both ACOG and the Society for Maternal Fetal Medicine to jointly state These are safe and effective. We need to inject all women thinking of getting pregnant, or breastfeeding. And that's still the guidance today in February of 2026. And in August of that year was when Comirnaty, which is the name brand of the Pfizer product, most people got the emergency use product even after Comirnaty was declared, safe by the FDA. People still in this country were getting the BioNTech product. But even in Comirnaty's own package insert, they state they can't say this is safe in pregnancy. But our governing bodies still state that that's the case. So this was the timeline. Statements were being made based on no sound data. So this is a pictorial representation of what's reported to the VAERS, which is our Vaccine Adverse Event Reporting System. You might have a similar system in your country. I know the yellow card is the system in the UK, I believe. This is a CDC program that goes back to I believe, 1990. It's very onerous by design, I would say, to put in a report. And, depending upon which adverse reaction you're looking at, there's anywhere from a 1 to 100%. The numbers that are reported, you could multiply those by 10 or 100 as far as what the actual number probably is. It's very underreported. I will be honest in telling you that I didn't really know about VAERS until COVID. I didn't know that if I provided a vaccine to somebody, I was obligated to report any reaction to this system. And I think that's by design because they don't want doctors reporting adverse events. But this was representing, the menstrual issues. And then this is representing the miscarriages. Now, there's 2 arrows there. Clearly, the one on the right is showing what was reported in 2021, and they combine both miscarriage and stillbirth. A stillbirth is a loss after 20 weeks or halfway through the pregnancy. A miscarriage is what occurs prior to 20 weeks. Most miscarriages occur in the first trimester, which is up to 12 to 13 weeks. But that arrow in the middle of that slide, I just want to bring to everybody's attention because that was when we had H1N1 flu strain. So a lot of pregnant women not only got the regular flu vaccine, but also got the H1N1 vaccine. And depending upon when you're pregnant, if you span 2 flu seasons, you get 2 flu vaccines. But also that's when the Tdap program started rolling out, the pertussis. We give women Tdap vaccine in order to build up antibodies to pertussis for the baby. So there's a lot of women in that little hill there that may have received 4 vaccines during their pregnancy. And look at what happened. So, I'm glad that we're going to start looking at all this with ACIP because I don't know of any studies showing giving multiple vaccines to a pregnant woman is safe. We, to this day, don't know what causes premature labor, and I would venture to say maybe it's all these vaccines we're giving pregnant women. I mean, inflammation in pregnancy is not a good thing.
Oh, man.
This is my data, which Jessica Rose, I sent my data to her primarily because Steve Kirsch had put a video out that went viral with me saying my miscarriage rate had gone up by 50%. And that got me in trouble with my chief medical officer within 3 days. So I had been compiling this data and I sent it to Jessica Rose because I wanted to be sure it was legit. Because I actually I didn't think she was going to publish this. I just wanted to have this as armor to, show my chief medical officer if my job was going to be on the line. So anyway, this is a great Substack that she published in the fall of 2022, but she's got a lot of data in that Substack. But this is one of the charts she made. So I went back in January of 2020 and I tracked this data until November of 2022. And I was tracking the miscarriages, but also newly entering pregnant patients in the first trimester, as well as our total deliveries. Now, in 2020, it was normal for us. We had many deliveries. Most were, delivered in November and December, wink, wink, because of the lockdowns. We called them Rona babies. Everybody had an explosion of deliveries at the end of that year. But we had the normal entry of newly pregnant patients, which is what the blue bars represent. And my miscarriage rate average from month to month was 4%, which I would say in all my years of practice was normal for me. I've never seen a 15% miscarriage rate. And my population is very diverse, ethnically, age-wise, medical comorbidities. I mean, I don't have a foo-foo practice where they're healthy and, all one ethnicity, etc. So, a 4% is normal for me. Now, when you go to the next year, what I said to Steve was not correct. My miscarriage rate did not go up by 50%. It went up by 100%. My miscarriage rate doubled. And you can clearly see by the blue bars from year to year, they've gone down, which is a reflection not only of miscarriage, but also infertility. I had women who had no problem getting pregnant prior to these injections. I had a local newscaster. Her husband was also on the news channel here, and they both had to get Moderna. It was mandated. They both had 3 injections. They had had 2 babies prior to their vaccines, and then she ultimately had to get in vitro fertilization in order to be pregnant with her 3rd baby. I mean, that's not normal. But if you then go to 2022, my miscarriage rate doubled again. Now, what's scary about that is even though the media was telling a different story and ACOG was telling a different story, a lot of pregnant women are in these mommy groups and Facebook groups, and they were all starting to chatter amongst themselves, Sally Smith had a miscarriage or had a stillbirth or had problems with her delivery, and she had 2 vaccines. I'm not getting any more of them. So most of my pregnant patients received their vaccines in 2021. Very few received them beyond that year. Most had 3 at the most. Very few had 4 or more. 80% were Pfizer. The rest was essentially Moderna. I had a few J&J or Janssen's. So what's going on in 2022 where we're still seeing these miscarriages because they're not getting these injections anymore? I will tell you, this data was up till the midpoint of November of 2022. In December, my miscarriage rate was 27%. In January and February of 2023 was 30%. Okay, didn't normalize back down until June of 2023, and I will tell you, it's been normal pretty much since that time. I think infertility is still an issue, and shame on our reproductive endocrinologists because they made bank with all the infertility they're seeing and treating now. But they also recommended these injections to their patients and their staff. This is the data I also presented when I testified for Marjorie Taylor Greene.
So your miscarriage rates were potentially doubling every year.
Correct. Correct. I'm trying to find my arrow here. There we go. Okay. Now, Pfizer knew there was an issue. This is their rat data that was procured by a Japanese physician, I believe, through FOIA. This is what happens when lipid nanoparticles are injected into rats. The lipid nanoparticles is the fatty envelope that surrounds the messenger RNA that's injected into us. And what that's supposed to do, it's a fat, it's supposed to attach to the fat of the cell membrane and allow the messenger RNA to go into our cells. Well, these lipid nanoparticles doesn't stay in the arm, folks, like everybody was telling us. They go everywhere throughout the body. I mean, this technology was originally developed to get chemotherapeutics across the blood-brain barrier. Okay, we have barriers in our body for a reason. It's very quickly and highly concentrated in the ovaries and the testes of these rats. And why is that a problem? This is a very busy slide. I had to go back and learn about mitosis and meiosis because I don't, that doesn't apply to my daily practice. But women don't regenerate eggs like sperm is regenerated. Okay, we develop our eggs very early on. By 22 weeks of gestation, a female fetus will have all the eggs she will ever have, and by the time she's born, that number goes down, and by the time she reaches puberty, she's left with about 300,000, immature eggs or pre-eggs, we could call them. And one of those follicles is destined to be ovulated every month. There's an average of 450 cycles a woman will have in a reproductive year. So one ovulation times 450. But some of those non-recruited follicles will also go through what we call a atresia, or essentially die. So by the time a woman reaches the age of 40, she doesn't have a lot of eggs left, and menopause is when the eggs are completely gone, and that's usually around age 50. So if these lipid nanoparticles are crossing the placenta and getting into a female fetus, what does that mean for that girl? Is she going to go through puberty? Or woman, is she going to be able to have a baby? These are questions that, if normal studies are done over time, can be answered. But of course, we didn't have enough time to do that because we were all going to perish from SARS, which obviously that didn't happen. This is a study that sadly came out, of Turkey. All these studies, they don't come out of the United States. I mean, where's Harvard? Where's Stanford? Where's Johns Hopkins doing all this research? This is out of Turkey on rats. They gave rats the equivalent dose of messenger RNA that they would give to a human. And then they did biopsies and some blood testing showing that they lost 60% of their ovarian reserve, meaning 60% of their pre-eggs or follicles were killed off after they received these injections. Now, this is only 30 rats, but still that's a huge signal. What's happening in humans, you know? This is what happens in sperm. This came out of Israel, because Israel has a very good data set. They keep very strong data on their population, and this was using the Pfizer product. It was only studied for 125 days, but that doesn't mean the effects don't span beyond that time. But men that received these injections not only had a decrease in total sperm number, but also the motility of the sperm, both of which are important with regards to fertilization. This is just one study. Arne Burkhardt, the late Arne Burkhardt, the pathologist, I believe from Germany, showed a slide in one of his talks where they, can stain for spike protein. He had a testes tissue slide in a man that had succumbed to the injection, and the whole slide was brown. Everything was spike protein, very little sperm in the testicular tissue. So, we wonder why birth rates are falling across, down around the globe. This is the Manish Czech data study, which showed that spontaneous conceptions have decreased from year to year in the vaccinated population. That's the dark bars on the bottom portion of that slide when you compare it to the unvaccinated population. So, why is that? We know that these products are in breast milk. These are two studies done by the same authors because they wanted to duplicate their data, which they did, showing fully intact messenger RNA in breast milk. And Naomi Wolf has shown, as has the VAERS data, that babies that drank breast milk had some bad reactions, which is scary because that kind of shows that this can survive the gut if they're ingesting this and then they're having a reaction. There's 22 deaths in our VAERS data from babies that breastfed from vaccinated moms, and I don't know, I didn't I've never seen that in private practice. I've never had a mom come in and tell me that their baby died from her breast milk. I mean, that's not a normal thing. This is a study showing that fully intact messenger RNA was found in the placenta and the umbilical cords of human babies. This was only 2 babies, but still, this should not be happening. If it's in the placenta and the umbilical cord, it's definitely going to the baby. The whole premise behind vaccinating a pregnant woman is for her to build antibodies that will cross over to the baby and protect the baby from whatever we're vaccinating the mom for. We don't provide a vaccine so that the vaccine crosses over the placenta into the fetus. How would you even dose that? Kevin McKernan, who was one of the people who found DNA fragments in these injections, he posted a Substack, he can't prove any of this, but just coming up with numbers about, what kind of a dose a baby would get of this messenger RNA from a breastfeeding mom if everything is in the breast milk. I mean, it's really scary. This is a pretty recent study that kind of shows that this definitely does cross into the babies. This was done in mice. So how this study happened was the mice were injected with an equivalent human dose of the messenger RNA product. And then they removed the fetuses. They did a C-section about an hour later. And they found that this messenger RNA was in the fetal circulation. Now, how can they prove that? IgG antibodies, IgM and IgG are what are produced in the body when we're exposed to a foreign entity. The IgM antibody is too big. It will not cross the placenta. So if IgM is found circulating in the fetus, that means the fetus is exposed to whatever that is. So this study showed that this is indeed crossing the placenta and going into the fetuses. I mean, this is not a good thing. And especially knowing that these are potentially contaminated with DNA. What does that mean if it's going to ovaries and testicular tissue? What does that mean for further offspring? I mean, is this something, is some sort of genetic something going to be, transmitted now from generation to generation? We just don't know. This is the only paper I've ever been an author on. James Thorpe is the primary author, but this was looking at the VAERS data. We went back to its inception in 1990, and we compared flu vaccines in pregnant women and what was reported to VAERS to the 40 months at the time we collected this data of the COVID injections. And we looked at 35 adverse pregnancy events that would be reported to VAERS. So, for example, if you look in the upper left-hand portion of the slide under miscarriage, so the 3 numbers, the 34, 94 numbers, the amount of miscarriages that were reported to VAERS with the COVID injection. The 315 number is all time going back to 1990 for flu vaccines. So the argument people will say, well, there were more COVID shots given to pregnant women than flu vaccines. That is clearly not the case if you're going back, 30 years now with flu vaccines? No way. Many more flu vaccines were provided than COVID vaccines. And the 936 is all vaccines because Tdap was introduced, but some women get vaccines if they're going to travel to other countries, etc. So if you do statistics on those numbers, the middle top, the PRR proportion ratio of 114 means that if you get a COVID vaccine, you're 114 times more likely to have a miscarriage than if you receive a flu vaccine. And I would say a flu vaccine is probably not 0 either. But clearly, none of the things we looked at They were all a very high PRR, and according to the CDC and the FDA's rules, if you have a PRR of 2, which is basically double the risk, you're supposed to look into that. So none of this is being looked into, or at least it is now, but prior to this administration, nobody was looking into this. This is a study that, as quickly as it was put out there, it was later retracted. You can't even find it now. Nick Holscher brought this to everybody's attention, but basically this was showing that this was found in people that didn't even receive the vaccine, which kind of confirms what we think is going on, which is shedding. Pfizer didn't want men having sex, wanted them to wear 2 condoms because they were afraid something might be in the seminal fluid and might be transmitted to their female partners. This study kind of confirmed that because they tested people that weren't vaccinated and found this in their placentas. The mom wasn't vaccinated and yet this stuff was in her placenta. But you can't find this study. So I don't know if these people were told to take it down by, said pharmaceutical company, or if maybe the data wasn't as sound as they thought it was. But we definitely suspect that there is shedding because people were having problems with their menstrual cycles early on. They themselves weren't vaccinated, but maybe their partners were, or they were around other people that had been vaccinated, in close proximity with a coworker, etc. And then all of a sudden they had problems with their menstrual cycle. This is a very concerning slide. Ethical skeptic is what this person goes by on X. But this slide shows children from birth to age 4 born to vaccinated moms. The excess mortality in that age group has been going up. They're dying. I mean, that's scary, you know?
Good heavens.
These are some other issues that, I saw in my population, not just pregnant, but my gynecologic population. I mean, breast cancer statistics went up for sure. I mean, we have Jessica Rose and others have published how the spike protein and the IgG4, which is what is being produced by continually giving boosters with these things, is causing through various pathways our cancer genes that make us not get cancer not to work properly. Breast cancer, the BRCA genes is what protects us against breast cancer. If we have a defect in that, that's what predisposes us to cancer. Angelina Jolie is a famous person that had this. That's one thing that's affected by the spike protein. But definitely below the age of 50, the numbers have increased. This is what I'm hearing at the water cooler, guys, because we can't get data beyond 2020 and our 2022 in our country. Trying to get cancer data, we can't get it. But definitely below 50, the numbers have increased, and bilateral breast cancers, which is not a common thing to be diagnosed with bilateral breast cancer, that has increased. I had a patient who asked me whether or not she should get the Pfizer or the Moderna, whatever. And I told her no, and she went and got it anyway. After she got her booster, she was diagnosed with bilateral breast cancer. She went to our local cancer institute, Moffitt, here in Tampa. They were telling all their patients to get boosters. She got 3 boosters and then developed a brain tumor, which they assumed was a breast metastasis. However, that's not a common place for breast cancer to metastasize to. She ended up having a craniotomy to resect the tumor, and lo and behold, the genetics of this tumor is completely different from her original tumor, and her oncologist is baffled. And I told her to have him call me because, as I had stated earlier, lipid nanotechnology, this stuff probably got in her brain, and that's why she has a whole different tumor in her brain. Abnormal pap smears has increased. I brought this to the attention of my chief medical officer in 2021 when everybody was breaking out in shingles when they got these injections. The virus we worry about, that's the varicella or chickenpox virus for shingles, but abnormal pap smears and cervical cancer is in relation to the human papilloma or HPV virus. And my concern was that this was going to be rearing its ugly head and causing abnormal pap smears. And the current guidelines for doing pap smears in our country is to do them every 3 to 5 years, and don't do them after the age of 65, because evidently cervical cancer magically goes away, which it doesn't. And I told my chief medical officer, I said, we're a large female organization. I think we should start doing annual PAPs. She all but laughed at me and said, well, ACOG hasn't told us to do that. So you do what you want, Kim. And I did. I started doing PAPs on all my patients. And then I had our lab run the analytics. And when you compared my pap smear rates prior to the vaccine, they went up by 15%, my abnormal pap smears. And I will tell you, a lot of women who have abnormal paps did receive the Gardasil vaccine. So,
Is it ever end?
Infertility, as I've talked about, abnormal uterine bleeding. A lot of women are getting surgeries because they're having this bleeding that we can't figure out why. Preeclampsia, which is high blood pressure in pregnancy. Early breaking of the water, which is premature ruptured membranes in pregnancy, along with preterm labor. That increased not in 2020, but after the shots rolled out. Growth restriction, because these placentas are for shit in these women that get these injections. I mean, Jim Thorpe's got a whole catalog of abnormal placentas, and I know you've had midwives tell you about that.
Yeah.
But concerning is postpartum bleeding. The postpartum hemorrhaging is through the roof. If there was a way we could do a study, which would be impossible because all hospitals have their own blood banks, but if we could look at blood usage in after delivered, postpartum moms, it's through the roof. I never gave so many blood transfusions in my life. I never did so many surgeries on this woman in my life. I did my first ever hysterectomy in a woman that just delivered twins because I couldn't stop her from bleeding. She's military and had to get 3 of the shots. And for reference, there's OBs that practice their whole career. They never do a hysterectomy for that indication. It's scary.
So right throughout, Kim, right throughout the pandemic and the pushback that was happening from people like yourselves, the authorities were saying, show me the data. Show me the data. The data is king. Now the data is out. And it would appear that you could whistle this stuff till Dixie and nobody's going to present this stuff on the mainstream media yet. And it needs to be out there.
Well, not only that, but my colleagues, if you talk to 99%, I mean, there's 100 OBGYNs maybe in our country of tens of thousands. I think there's 60,000 members of ACOG, and there's OBs that don't belong to that. So there's many OBGYNs. There's probably 100 of us talking about this maybe, and there's only about 5 of us that are vocal, But if you ask an OB, they'll say, well, I didn't see an increase in blah, blah, blah. Well, that's because most obstetric practices in the United States are many providers, midwives, many obstetricians. If my partner's GYN patient comes in and says to him, I had a miscarriage last month, I'm not going to know that. I mean, you have to drill down in your electronic records to get this data. And quite frankly, people are lazy and they don't want to do it, but the data is definitely there. All birthing centers, all labor and delivery wards in our country have to keep these statistics. They know how many people bled. They know how many people had an early loss or a stillbirth. They have this data. They have to report it to the state, C-section rates went through the roof too because the placentas are crappy. So, babies weren't tolerating labor. That's all data that's kept on labor and delivery wards. The data's there. The cancer data's there. Why can't we get cancer data? Why can't I get stillbirth data from after 2021? It's there. They don't want the masses to know is why. And this confirms what I saw. This is right out of the gate this month, showing that hypertensive disorders in pregnancy were increased from the vaccine when they compared these two populations. lots of people, So what have we done? This was an experiment on billions of people around the globe, and I can't even believe we ever gave this to pregnant women. I mean, nobody should have gotten this, but to pregnant women, I mean, oh my God, it's criminal. I think that's the end of my slides. I think the next two are just some links that I gave you for the articles.
I just want to share something that John sent me while you were sharing, Kim, which is very unusual. Channel 9 is one of our mainstream outlets. I'm going to have to edit here, of course. I don't want everyone seeing
baffling.
stuff.
What could it be, right? It's climate change.
Well,
Yeah.
interestingly enough, when you open up the article, it's suggesting that it's the cost of living.
Well, it's cost of living. My children are 26 and 29. They've been conditioned now to not create carbon, right? Because carbon's ruining the planet. Well, part of carbon's a baby. And yes, the cost of living, but I mean, people have been having babies. The cost of living has been an issue for many, many, many decades. I mean, you used to, in my country in the 50s, the husband went to work, the mom stayed home. You were able to afford a house, a car, a vacation on one salary. I mean, that's been many, many decades not the case. So, it's because people can't get pregnant or they're miscarrying when they do. That's definitely part of it. So.
Well, Kim, we've filled the hour and we've filled it very, very well. I've got to say, John and I have done 600 odd interviews, and we've interviewed Naomi Wolf over 2 parts in 2 hours with some politicians here in Australia joining in. And that information was incredible and frightening. But I've got to tell you that I think this is probably one of the most telling interviews we've done in relation to pregnancies and the population rate. And we can't thank you enough for it. You said you'd never done podcasts before, and you stumbled and worked your way through it. I tell you what, that was amazing. That was amazing, and it goes hand in hand with so much other data we're getting, and some of the interviews we've got coming up. Like we have Sally Clark, who is an Australian academic who now works in the Philippines, who was part of an investigation done by the Philippines government into the excess death rates going on as a result of the COVID vaccines. And the Philippines government, halfway through the investigation, put a stop to it. And she's got this amazing data and even more that she's going to release on our program. And I think you'll find that compelling too. We'll get that to you.
Yeah.
John, what have you got to say?
Well, look, I think it can be summed up pretty simply, Hoodie. I mean, there was a neonatal nurse in the UK that was convicted of killing 7 babies and attempting to murder 7 more, and the world was in absolute outrage. Absolute outrage. And I'm sure that the trial probably went ahead with 1 or 2 experts. But when you look at this in comparison, babies that aren't even born yet are being murdered. The death rates are, who knows what they are. I mean, they're off the scale. Numerous experts, not just 1 or 2 in a courtroom. I mean, you take the caliber of this lady here tonight speaking to us. Kimberly is one of probably thousands of doctors and experts around the world that know this stuff's going on and are speaking up. But the authorities, the police, will do absolutely nothing. The bureaucrats are just sitting on their backsides, and I don't know what you've got to do. You can have an inquiry or a criminal case into somebody getting food poisoning or killed by a mushroom or something that the media goes absolutely nuts about, but nothing to see here. It's just we don't need a royal commission in this country. We need a Nuremberg 2.0 because worldwide this stuff's just madness.
And you look at that in relation to the current release of documents around Jeffrey Epstein, and why are we not seeing arrests? Why are we not seeing outrage on the mainstream media? Why are we not seeing outrage throughout the world? That it's just human life means nothing anymore. And what you've just been describing, Kimberly, is pretty hard to. It's hard not to see it in any other light other than we're looking at government global sponsored abortion and population control.
Hmm.
I mean, can you sum it up in any other way? How many coincidences can there be?
Well, and I think too that this is probably sadly going on for a while because, I don't know if you're aware, but there was a Tdap vaccine program that was rolled out in Africa, and they had the beta HCG protein, which is our pregnancy hormone, in the vaccine. So those women were now making antibodies to pregnancy hormone, which means when they conceive a pregnancy, it's going to immediately terminate because they're making antibodies. Now, who knows how many other vaccination programs that may have occurred in? I mean, globally, birth rates have been going down for a while. I mean, a lot have been very drastic in the slope since the COVID injections, but who knows? I mean, I just think, why do these people think that they have the right to decide how many people should be roaming the earth? I mean,
It's frightening.
I don't get it.
Kim, have you ever watched the deposition with Aaron Siri and Stanley Plotkin, the 9-hour
Hmm.
deposition? Now
Yeah, I
that's
have
frightening.
Aaron. I've never met him. I obviously know of him. I bought his book, which I haven't been able to read yet, but he is just like Bobby Kennedy, neither one are physicians, but they're so knowledgeable of this topic and can cite articles like the back of their hand, and it's sad that two attorneys need to do this and our own medical establishment just turns a blind eye and still, follows this religion of vaccines. I mean,
Well,
and
we had,
as soon as I was when I was in Australia and they made the announcement, the Washington Post ran this smear article on me, which I didn't want to read, but I'm immediately labeled as an anti-vaxxer, which my kids had every vaccine known to man. I used to get the flu vaccine. um, I won't get any more because it's not that I don't believe in vaccinology or immunology, but what we're putting into people needs to be proven to be safe and effective, and we need to have a good reason to give it. Why are we giving kids a chickenpox vaccine? Children don't die of chickenpox. I got scars on my face from chickenpox, okay? Bobby Kennedy will tell you because it was developed so parents wouldn't have to miss work. And that's why shingles is so prevalent now because kids aren't getting chickenpox and boosting the adults around the world. So now they're getting shingles, but that's okay because we have a shot for that too.
oh man,
It's just madness,
man, look,
you
we
know?
we would we would love to get you back on again. There's so much more information we can unpack with you, and we'd love to get you on a panel because it's getting to a stage. Dr. Tess Laurie in the UK has just agreed to come back onto the show, and with Andrew Bridgen rather, coming onto the program from the UK. It would be great to tie all this together. So I think we're over time, so we need to close this with a prayer, if you don't mind.
Not at all.
Dear Lord Father in heaven, your scripture clearly says that he who harms the little children, it would be better for him to be thrown into the river with a millstone around his neck. Father God, is there enough millstones? Are there enough millstones? And Father, we just pray that people like Kimberly will be protected and more will join her ranks, and we will see truth and we will bathe in the light of truth, knowing that the truth will set us free. Lord, we need you now more than ever, and we thank you for our wonderful guest and the work that she's done, and we ask you to protect her in the precious name of Jesus. Amen.
Amen.
Johnny Larder, you've often been heard to say,
You just couldn't make this stuff up.
You couldn't make this stuff up. Kimberly, you've been an amazing guest. Thank you so much for your generosity. And we're glad you got to hug a kangaroo, not a kangaroo, a koala. We're very glad it didn't urinate on you because that's not a very pleasant experience. And we look forward to having you on very soon when we discuss these issues. We can't let this rest, John.
No, we can't, Hoodie. And as Senator Ron Johnson said, it's up to the physicians and the medical people to speak up. That's where it's at now. There's not enough speaking up, not enough brave
No.
people like Kimberly that are speaking up. And you know, it's your time. It's your time to do the right thing.
Yeah, well, there are a lot of people, querying a lot of things that Donald Trump's doing as president of the USA. And one thing is for sure, John, I sincerely hope that he gets through the midterms and maintains some control, uh, only for the sake of medicine and restoring medicine and confidence in the health system. So, boy, oh boy, these are crazy times. Well, Australia, that's it. Another great interview from Club Grubbery. Don't forget what you did yesterday got you to today. So just get out and enjoy the sunshine. Don't get too bogged down in all this stuff. But for goodness sake, please share this one in particular. Send it to some politicians. Speak to someone you know. Many people know some of these doctors who are prominent in Australian media, Dr. Norman Swan and whatever. These are the people, Dr. Daniel Ninio, John. Uh, Daniel, you need to have a really good look at this data, for goodness sake. He's been very quiet lately, but anyway, stay out of the trees, everyone. Thanks for watching Club Grubbery, and we'll see you next time for another outstanding interview. God bless you all, and bye for now.